we know that a lot of time people may either report how the experiences, and fortunately, just a year ago, there was a survey by a charity called Black Women Rising, and they did a 100-women survey. And this survey did actually highlight the impact that not having appropriate things like breast prosthesis following a mastectomy for an individual can be. And about 74% of the respondents actually commented on how it impacted on their recovery, their confidence, their quality of life, how it made them feel unseen, unheard. It made them feel like they were not being cared for. And that is the impact that health inequalities can have on people, the psychological sequelae that it has on them, because they feel completely abandoned. They feel that they are not being part of that care process. They are not being acknowledged as individuals, as people. And so having that data, it was quite important that we address that. And one of the steps that we could address that was actually looking at the provision of service that we have. And so we have a service, but that service is not equitable. There is a service available, but that service is not looking out for all the other people who are walking through our doors day in, day out and being given care. And so we had to look at ways of addressing that and meeting their needs, because we know that cancer has huge impact on people, on their mental well-being, psychological well-being, physical well-being. And it's important that patients' voice are heard and the care that we're giving to them meet their needs, to make sure that they can progress and survive, and not have this huge mental impact of their treatment on them. So I think the real take-home message is that we want to really try and encourage and also to engage with healthcare professionals in the country and even beyond, to really looking at their health service support and care, and do everything they can to address some of these inequalities, and sometimes doing something as simple as in expanding the service that is available can really help have a huge impact on patients. And so far, we've had really good feedback from the people who have had opportunity to be fitted with these prostheses. And we know that it's having positive impact in terms of their well-being and survival. So just looking at services, challenging ourselves a bit, and listening to patients and engaging with them in terms of the care we give.